Welcome to Pioneer Clinic. Today's topic for video is when someone has a large bald area, usually we do recommend 2 sessions. And usually, when we harvest the grafts from the scalp to scalp, we usually recommend minimum gap is 6 months. But when patient has a time constraint or they want more grafts, so what are the possibilities that we can go with? And for such patients, we can do 2 consecutive days and we can harvest more grafts. So such scenarios we would like to discuss today. Procedure instead of doing one day, if we can make it in 2 days, we can harvest more grafts. Kindly watch the video to understand details of such 2 days procedure for the large bald area. Usually we can target 3 to 3,500 grafts from the scalp in single day procedure. And of course, there are a few cases we can target more, but usually the limited number is 3,000 to 3,500 because the harvesting time or implantation time, if it goes more than 6 to 7 hours, our grafts will die. That's the reason we always limit for 6 to 7 hours procedure where we can target 3 to 3,500 grafts. So this is the routine procedure we do. But when someone has a large bald area, when someone wants more grafts, then what do? Usually we do second session after 6 months. But someone has a time constraint. For them, what do? So for them, we can have a second day procedure, 2 consecutive days procedure. First day we can target 2,000 to 2,500 grafts. Second day also we can target 2,000 to 2,500 grafts. By adding one day extra, so we are getting extra time so that grafts are not going to stay outside for longer time. We can target more grafts. And that is the reason we can plan a 2 consecutive days procedure to target more grafts to implant in a large bald area. So someone who has a time constraint, someone has a large bald area, they would definitely go for the 2 days procedure. Someone who has a little less donor, suppose they want to get it from beard grafts. Yes, first day we can target grafts from the scalp. Second day we can target beard grafts. That also possible. And here beard grafts definitely accounts for implanting in the mid scalp where we can get more density. So there are a few limitations with the beard grafts that we cannot use in the hairline because the beard follicles grafts looks different and it's curly too. That's the reason we need to combine both the scalp and beard grafts. In that such scenarios, definitely 2 days, 2 consecutive days procedure definitely would help to not only get more grafts but also to get combination of mixture of this scalp and beard grafts to get uniform density, because the beard grafts cannot be utilized in frontal hairline as well as the crown area alone. In such scenarios, we combine both the grafts and implant it, or we're going to make these beard grafts in the mid scalp, which is going to enhance the good density for us. Doing transplant in 2 consecutive days or 2 days procedure definitely would help someone who has time constraint, because most of the guys will be busy days nowadays, busy in their life. They cannot travel multiple times. Imagine someone is traveling from abroad, so they want to come for multiple sessions. Probably it's kind of a financial stuff and even time constraint. For such people, someone has a class 5 baldness or even more baldness, they can always consider this 2 days procedure, because instead of getting 3,000, 3,500 grafts, you can get even 5 to 6,000 grafts. So that is the best way of getting it done, because the more coverage is possible with more grafts and more density also possible. To save the time and multiple travels, definitely this technique would be very useful for the patients to achieve their desired results. Conclusion of this video, or a take home message of this video is, usually when we have a large bald area, obviously we need large number of grafts, where there are few limitations in graft harvestation in one day, single day, because of time constraint. In such scenarios, we can plan second day, that is a 2 days procedure. Or when we are doing second day transplant, either we can target the graft from the scalp itself or from the beard also we can target. A very few scenarios we can even take from the chest also. Usually this scalp and beard grafts goes well and in glove, so that and we can a combination of both beard and scalp grafts can also get you good density for the people who has large bald area, and more coverage we can do. So that is the advantage of having a 2 consecutive days procedure to target more grafts and to target larger bald areas. Thank you. Thanks for watching.